To the Northwest Territories next, where many expectant mothers are receiving some difficult news. If their due date happens to fall in the next few months, they won't be able to deliver at their home hospital in Yellowknife. Instead, they're going to have to travel nearly 1,500 kilometers away. Michael Serapio is on the story for us this morning. Michael, where will they have to travel and why?
Well, they're going to actually be sent to Alberta hospitals, Edmonton in particular, Heather, and this is because of the concern over the quality of care that they can provide right now at the Stanton Hospital in Yellowknife. Now, of course, this is an overwhelming time for parents when a new child comes into their lives, and this policy does create some very real challenges. Take Naomi Pearl. Now, she is just weeks away from her due date, but she is going to be sent to Edmonton, and in the process, she'll also have to leave her 1-year-old at home while she gets ready to give birth. Not great news for her. Take a listen.
Who's going to watch him, right? My son's always with me. He never leaves my side. And I can imagine a mother leaving their kid that long.
But up against that very real struggle, the N.W.T. Health Authority says it is struggling right now. They just don't have enough nurses to ensure safe deliveries at the Stanton Hospital, again in Yellowknife. Now, this is the facility that's used to deliver the vast majority of recorded births in N.W.T. So this is a big problem. And to address it, well, the Health Authority says expectant mothers will be transferred to Edmonton, where they can get the kind of care that Stanton would like to give, a 1-to-1 nurse-to-patient ratio. Now, this will apply to patients expected to give birth from December the 10th to February the 21st. The hospital says this is temporary. They are right now trying to recruit more nurses. But for patients who will be transferred, well, the health authority says the following. Pregnant people will generally travel before or during their 37th week of pregnancy. The territory will cover the cost of a non-medical escort or companion for the patient, and people will spend between 3 to 5 weeks on average in the location where they'll give birth. So this will affect the vast majority of scheduled deliveries in the in the territory, Heather. But some important exceptions here. Scheduled births will still take place in Inuvik. Midwifery support will continue in Fort Smith, and services will not be affected in Hay River. As for any emergency medical or prenatal issues, the health authority says those can still be handled in Yellowknife, but still very difficult news for expectant parents in the territory, Heather.
And weeks in Edmonton? I mean, can Alberta Health Services handle these new patients and all of the volume and their requirements, Michael?
Well, and it's a great question considering all that Alberta Health Services has gone through these past months with COVID-19. But the two health authorities have apparently been speaking. The N.W.T. authority says AHS is confident that they can provide the care and the services that N.W.T. would like here. The one potential issue here, though, is vaccines and COVID-19. Now, until the end of this month, unvaccinated patients can travel to Alberta with a negative COVID-19 test, but they're trying to determine what actually happens after November the 30th. At this point, we can tell you that the territory is encouraging pregnant individuals to get vaccinated as soon as they can, because again, this will apply for births from December right through to February, Heather.
Michael Serapio, thank you very much.
You're welcome.